Well, welcome back from that short commercial break, and welcome to our second hour Smart Minutes Business. Just 9 minutes, 10 minutes past 8 a.m. and you're still watching Smart 24 TV. And of course, you can catch us on DSTV channel 372 and GoTV channel 320. And of course, we're always streaming live on YouTube. Just go and type in Smart 24 TV and go to the live section. And of course, if you're a newcomer, please don't forget to subscribe, okay? Because we have interesting packages for you. And of course, we have a Smart Digital application. You can go to your Google Play Store or Apple Store and just go type in Smart Digital application. It's going to be coming your way. We have different radio stations you can listen in, also TV. You can watch us live. Like okay? Yeah, that's the
Have they understood that? Have they understood that? Give the Luganda version of that, baby.
Luganda version, but I'll really consult. Yes. Definitely. And of course, we on our social media handles on Facebook, Smart 24 TV Official, and Twitter or X for Smart 24 TV now. Yes, and of course, your personal, what's your handle? Where can catch you from?
Dbakakem. Get to me on X and let me know what you think about some of these different topics that we are having. Now remember, top of the hour, when it comes to 8 o'clock, we remind you about how to seize the day. We remind you about the positive attitude that we have here at Smart Means Business here live on Smart 24 TV. How do you seize the day? How do you set your mindset? How do you attack the challenges? To help you through the day, let us give you just a business quote that will guide you and inspire you. Business quotes coming up.
And of course, as you heard it, the harder you work, the luckier you get. And of course, we were debating about it, if it is really true. No, listen, the debate was the conversations that, go around the youth. Is it about luck?
I heard you mention Peoza Bajaja.
Peoza Bajaja, and you work hard, but really nothing.
And this is the mindset, Mercy. The mindset is there that, you know what, even if I don't work, once I am lucky, once we are blessed, and this cuts across really, whether you are talking about, the African traditional sense of it, or right now, the different religious fraternity, whether you are lucky or not, the reality about it is that you must work. Now, this brings forth a different perspective, that the harder you work, the luckier you get. It sort of like dispels the myth about you being lucky, that wherever you go, no matter even if you sit, the money will come to you. Well, this is dispelling that.
No. Someone would have an argument of, I have had the best grades, but I am not lucky enough that I'm getting employed.
You're not lucky because you're not working hard. You're not like,
but I have the grades. I have all it takes.
I remember it was brought. It's not really about just the brilliance and the intellect and the ability to pass. True. The grades don't really mean. Yes. Do you have the skills? Do you present yourself in such a way? Do you network? Do you get out there and do something? Do you pilot some of your projects? Some of these things really, it comes down to how much work. But getting back a couple of years back, I remember it was out there, and the president mentioned it and said, get out of those churches where you are sleeping every now and then, having the overnights, and go and work. And I remember there was quite a lot of conversation on that, and it comes under this bracket: can you get out and work instead of spending all your time and you're in there having those overnights. We have nothing against overnights. Yes. We have nothing against prayer. But the reality is you basically have a combination of prayer and hard work. You have a combination of good mindset and hard work. You have a combination of all these different things, but you must apply hard work as well.
Well, there is no exception for working. Even the Son of God himself, who was a carpenter.
Yes. He was and did. But now, the other part of and we will continue this conversation later on. The part about it is whether to work hard or work smart.
Oh, it's about
yes.
Whether it is about hard. Working smart lately.
So what
lately
comes in
is how smart you are.
Yes,
because you work hard, and like I said, someone will tell you I work hard, but I've not been lucky.
I'm not getting anything.
But really, those who
work smart.
Yeah.
Work smart.
They get the big fish.
We'll give you an instance. You can't wake up at 4 o'clock and be first in the market because you are a vendor. You are a vendor, and we have nothing against this business really. We are just trying to compare the different versions of working smart and working hard. You may be there 3 a.m. and you are there, but working smart is someone still in his bed and is calling the different clients and said, what time can I deliver to you?
Yeah.
Yes, both are different cabbage vendors, all in one particular market. One is there saying, I'm the early bird, I will catch the first worm, I'm going to be here by 1 a.m. or 3 a.m. And the person is waiting through the cold and everything. And another vendor is right into his bed, making appointments with those clients. He will come in at around 5 a.m. or 6 o'clock and deliver to those. So please, even as you're talking about working hard, compare and find out how best can I work smart. Some food for thought for you this Wednesday, the 10th of July, 2024. Some of you still write 2023. Others have already jumped and decided we've given up on 2024. Given the fact that it's running so fast, let's just dive straight into 2025. We'll do you at whatever pace it comes in. Let's dive back into the undertone of how we started off this conversation much earlier at 7 a.m. What did we talk about? We talked about that we are going to be looking at the past strategy. And we did just right about that. We talked about the ABC strategy. We talked about the initiative presidential fast track approach, where it was brought about that the 90-90-90, get the 90% tested, get them on ARVs 90%, as well as have 90% with their suppressed viral loads. And I believe Uganda has done quite well in regards to that, quite so well that right now it is expected very, when it comes out to all the different key players in this, they are waiting for the outroll of this particular injection, the injection that is got twice. Yes, that is got yes, once or twice a year.
Oh yeah.
Yes, wow, it was. It's been for quite some time. Talked about, and good news was coming out that it had finally passed the standard test and everything. So I believe the persons living with HIV as well as the other key stakeholders in this are eagerly waiting for the rollout of this.
Yeah, for women, because for women,
yes,
I remember they were suggesting that for prevention purposes, the injection.
You do have the prevention, the one for prevention, but of course as well you do have the other
for
that
treatment.
Comes. Yes, the treatment. Yes.
But I believe the one for prevention should be, quickened up because it's now surge. It's becoming too much.
Yes.
Yeah. And why they chose women, I think in particular, is because they spread it more compared to men.
They are the recipients.
Yeah, the recipients.
And the carriers.
Yeah. So it's better in women, and most of them are mothers. So it's better.
And that is true. But of course, when you come down as well to the preliminary findings of the census, women, we have more women in Uganda than men. So this one also comes into play. But that does not exonerate the men. Of course it doesn't. You had quite a number of strategies, such as the self-male circumcision that have taken global storm, not only just in Uganda, but elsewhere as well. And these have really been adopted now within our particular conversation from 9 today, 9 to 10, we will be talking to Dr. Watiti, Stephen Watiti, very renowned health promoter as well as HIV/AIDS activist, who will be telling us a little bit about giving us insight into what is happening. We will be talking about some of the communication strategies that have been talked about, especially in the implementation of some of these strategies. Have they backfired? Why is it that some of these have actually not turned out with the right results? And what is it within the communities? What are the people talking about within the communities, especially when it comes down to different activities such as the safe male circumcision? It should be interesting. Please join us from 9 o'clock to 10 as we have this discussion with Dr. Stephen Watiti. Now, what are those gaps? What are those gaps? We've had those success rates. What are those gaps that have come out? Like I said
earlier, before we went into a break for Karibu, for East Africa, you remember I told you that the poor accountability,
corruption.
Okay, fine. Okay.
Misuse, funds misuse.
Misuse of funds,
say it as it is.
Yes, okay. Yes, misappropriation. Yes, misuse of funds, actually. The money that was meant to facilitate medication for these patients went missing in action. Missing, and people started missing out on
from way back
on drugs.
Yes, from way back.
It wasn't accessible in health centers. Can you imagine?
Yes.
There's a time actually it went scarce. Yeah, and of course it even became once during COVID-19 where there was no accessibility, of vehicles or borders to take these patients.
Yes, the transport system was down.
The system was really down, and of course that led to the increase.
Yes, because now the thing about ARV use is that you must take it consistently. If it is 9 o'clock every morning or 9 p.m. every evening, you must take it. Try as much as possible to take it, and this adherence is very important. This is what the consistency is what actually suppresses the virus within you to such a point that right now with the 90-90-90 approach that was effectively meant to target I think 2020, during 2020, that was the expected time that it would be seen to have positive outcomes. Now, riding on that back, the reality is that for this to actually be effective, for the ARVs to work effectively, it must be consistently taken at the same times, trying as much as possible to take at the same times. Now, when you have hiccups, such as happened during the pandemic, the lockdown, when you have hiccups in transport and some of these ARVs cannot be accessed, then you have that particular inconsistency. That means the uptake is slowed down, and that means most of them get to miss. Now, when they miss, the virus that was initially suppressed rises up. Now, when it rises up, that not only makes you susceptible, doesn't only make the patient susceptible to opportunistic diseases, but that means if at all they do have sexual contact or any other sort of particular contact that with blood and all that, definitely it will be passed on. Now, this was a challenge, of course. And when it comes down to pregnant women and all this happens and they cannot be able to access these life-saving drugs, definitely it will be passed down to the children. So that means when it comes down to consistency, to the availability, it is very, very crucial. It is very crucial that these ARVs are availed and the persons living with HIV who have started can as well access them.
I would also mention it's not a failure, but maybe laxity of sensitization in particular, let's say, areas, where we think as people,
Yes.
And because I will tell you what, there's a particular sector, the construction sector, those that work with different companies, building, construction companies, that is where the problem is, If we could have people come and sensitize those guys.
What's the problem?
The problem is moving from one district to the other,
Yes.
I have a representative of a woman or women in every district. Yeah. So the moment you contract the disease or the virus, you're spreading it.
So is the problem because they are moving from one place to another so they cannot access? Is that the challenge?
Yeah, the challenge is that there is no much sensitization when it comes to that part.
The movement. But when it comes to the movement, the different practice when it comes to dispensation of these ARVs is that I think if you're suppressed enough for quite a long time, your viral load has been suppressed, you can actually get these medicines for a period of like 6 months. Yes? So if you're the type of worker who gets to move from one place to another, within 6 months, yes, you know that you have your medicines, or sometimes I think within 3 months, you have your medicines with you, and then you know that your next appointment to go and pick up some more is on this date. So you can actually schedule your activities and get back and make sure that you don't miss a day. And normally the way they schedule them is that by the time you go to get there, you don't only go to pick up more when you've run out. You go to pick out some more when you still have some left over.
Yeah, okay. What I really, yeah, that's also good, but I really, what I meant was the initiative.
Yes.
Yeah, the people responsible for, you know, sensitization, making sure that there is prevention. You know, there are some places where there is no education whatsoever. You know, you go to these, like I said, construction. You know,
yes.
the companies are not, you know, willing to provide even healthcare of an expert, you know, to inform
yes.
these particular workers on what should be done. You know, there is few of them have access to condoms. You have to walk maybe to the trading center and get one.
Yeah.
But how many of them do you think will have time to think that there is also
Let me walk.
There's also the truck drivers. Remember?
Yeah.
Yeah, the truck drivers are also among the people that need to be sensitized.
Yes.
Yeah.
And that's true, Mercy. Coming to think about different companies, we all know that in most cases when it comes to project, when it comes to companies, some of these labor policies that are, you know, and all this documentation that is internal definitely has to have that component. You're not only just looking at labor working conditions and maybe the wages and also, but you're also looking at the health care. And sometimes these particular components that we're talking about are notably followed up on when it comes to projects, especially big projects. That's why they make sure that their batch of workers are sensitized in regards to this. But now when it comes down to different companies and different organizations, that is where it is the most important to have this done on a routine level, so that at least even as you go about the different sensitizations, as you recap on some of the different policies internally, you must as well go through the different, whether it is GBV, whether it is gender, whether it is HIV, AIDS, these must be routinely done. Not necessarily just waiting for the big projects and to have these implemented and actually followed up on. You must start from as early as possible. This is the ideal that it is supposed to be. But like you mentioned, Mercy, it's not done everywhere in every company.
Yeah,
and
not in every company. Where I'm seeing where the loopholes are.
Yes.
You know, the truck drivers, the construction workers, really. You will go and you will barely see a driver with you know, a protection. Yeah, and yet they're moving from one district to another.
There was a time when they had these dispensation areas, if we can call them, and the initiative really was upon that, because the challenge now with this is that most of this is done under projects. That means when the projects phase out, there is nothing really on ground. If at all, some of these, I know for sure that when the tracking population was brought out, especially, and the increase in the prevalence along those tracking routes, the Ministry of Health tried to do something. They had not only the civil service and the different organizations coming on board, but I also know for sure that some of these gaps here were being addressed by the Ministry of Health. Now the challenge, of course, is that they are funded, and when they are funded, in most cases it's not sustainable because they run out of those particular funds. And also it depends. If there is a lowering in the rates, then you know they get off. Yes, there is a little bit of laxity in regards to that. And when there is an increase, a resurgence, then they come back as well. The organizations, all these key stakeholders tend to behave like that. But it still boils boils down to funding. Sustainability can only be enabled by funding, and this funding here is pretext on the fact if you prioritize these particular areas. Now, these particular gaps were apparent, they were increasing, but because they had not been prioritized, it shows obviously that the treatment was more prioritized, and this is where most of the money was going. But we also talked about the fact that Uganda's spending on the HIV budget was 85% budgeted, catered for by external financing. Now, because of some of the other policies, LGBT and all that, you have had this slashed significantly. And when it is slashed, that means most of the personnel is being let go. We have quite a number of medical personnel that were previously on some of these projects being slashed off because of reduced external funding. And when that happens, that means also some of the programs, especially in regards to sensitization, are also halted. So these are the challenges that come in, and maybe some of these challenges are leading to the increase can also be linked to the increase in the new infection rates. We will be talking about later on from 9 to 10 about what strategies can be adopted for that. Is there any more news in regards to that, Mercy?
Well, I think we are going to get more insight. Let the expert speak for himself and educate us, on what is happening, and make sure to emphasize the fact that that yes, the funds are there, but how are they spending it?
Are they spending it?
Are they spending it
the way they should?
They should. Yes.
Yes.
Well, fine. We may have some hold on some external funding, but how appropriate are we using what is available?
What is available?
Yes.
When you have 1 billion, it is massive. You had 1 billion right now with you, and you just may do that. Who knows? People hiding money under their mattresses these days, MPs and all that. So, but if you have 1 billion, it is okay to, not to track. But the moment it goes down to 1 million, then the eyes are all over. How much did I spend today? What has been spent today? So maybe it is under the same pretext that, yes, when there was lots of money coming in, it was spent a little bit lavishly and this and that. But now that it has gotten down, this is when they're taking into context and saying, you know what? I think the monies are not enough to pay all these persons. Can we send off some? Yes. In fact, I've had reports coming in, and some of this news told to me by some colleagues working in some of these places, that if at all they had staff that were being paid a little bit of a higher salary, some of these are being sent off.
Wow.
And those who can take on a lower salary but still be able to effectively deliver the service are being hired. One, because they still need the personnel but cannot afford to have those ones at a higher level. There's quite a lot of change happening, and all this has to be amidst the shrinking of the funding base. So a lot has to be talked about. Is it all about Uganda trying to look at some of the ways in which we can fund our own? Rwanda right now, this HIV/AIDS is part of the healthcare, and there is an insurance, from what I gathered, that there is an insurance and all that policy is being activated. That means someone who is sick can still be able to walk in and be able to get the testing, to get the treatment, as well as the support, all as a package. So maybe, and Uganda has this, but unfortunately, most of it is coming from external funding. Well, something has to be done about that. Right now, it is time to get into a short break, and later on, Mercy will take you through with entertainment and sports. Please join us from 9 to 10 as we have the discussion with Dr. Stephen Watiti, talking about addressing those cyclical